Hi viewers, welcome back. In today's video, we are going to discuss the continuation of the minor ailments of pregnancy. In the last class, we have discussed the minor ailments that is pertaining to the GI tract. So, that is like we have discussed about nausea, vomiting and tirelism and heartburn, all those things we have discussed. So, in today's class, we are going to discuss about the problem that is related with the musculoskeletal system. Okay. So, we have major 4 problems that is like very commonly reported in the musculoskeletal system during pregnancy. Okay. So, the first thing is ligament pain, then we have leg cramps, then is backache and fatigue. Okay. So, these are the 4 common problems that is usually reported during pregnancy. So, again the same principle, we will see why this pain or the discomfort happen, and then we will discuss the management, that is home management. Okay. So, first is the ligament pain. So, what happens? Ligaments are the supportive muscles which are surrounded around the uterus. Okay. So, they are going to support the uterus during pregnancy. When the pregnancy is like proceeding, when the mother is improving with the pregnancy, when the baby is putting on weight, what happens? These round ligaments are going to stretch and it is going to cause pain for the mother. So, usually she will have pain in the lower abdominal region and in the groin. So, when she is walking, she will have severe sharp pain. So, that she will be reporting as severe pain during pregnancy. That is usually felt in the later weeks, that is when the baby is putting on weight. At that time we are able to perceive the pain. Okay. So, this is the very common problem, and it is also like she is like very weak and tired, like sometimes because of this fatigueness also she will get ligament pain. Okay. So, management, when we come to the management part, the first management is local heat application. So, local heat application is either you can provide it with a hot water bottle or like hot fomentation you can give. So, anyway, like wherever she is complaining of pain, so there you are supposed to give hot application in that area. So, there will be a mild spasm in that area, and which is going to get relieved with your hot applications. Okay. So, this is the best method whenever she is complaining of round ligament pain or any pain in the groin or leg, anywhere you have to give an hot application. And then coming to the gradual movements, that is like when the mother is starting with movement. So, when she is starting for a walk, so at that time how she must start with her walk. So, slowly she has to start and then she has to proceed. So, it is not like suddenly she is like walking very fast. So, when there is an activity, like immediately she must not go in for a heavy walk. Slowly, that is like step by step she has to improve with the movement, so which may not cause sudden sharp pains. And then we have psychological support. So, already I have said you, psychological support plays a major role during pregnancy. Okay. Tell the mother that your baby is growing, and because of these ligaments are stretching, and when these ligaments are stretching, it is causing pain for you. Okay. So, it is not going to happen like it is not going to endanger you or the fetus. Okay. So, it is just a pain because of the growth of the baby. So, you have to psychologically make her understand that this is a normal thing. So, that is with your round ligament pain. And then comes the leg cramps. So, leg cramps, like it is again which is a very commonly reported complaint of the mothers and usually felt during the last trimester, that is like in the later weeks of pregnancy, and usually this is present in the night. So, commonly mothers, they report leg cramps at the night. What is leg cramps? That is like sudden spasm of the muscles. Okay. So, usually these calf muscles and your knee muscles, they will have severe spasms. Okay. So, that can be said as leg cramps. Why this leg cramps happen? Actually, it is because of the weight of the baby. Okay. So, first is the weight of the baby, and sometimes it is because of the posture. So, when she is walking, how she is walking, the high heels type of shoes, and all those things may increase the condition. Sometimes it is because of the electrolyte imbalances of your calcium and phosphorus. Sometimes there is a pH imbalance that may cause leg cramps. So whenever the mother is complaining of a leg cramp, what we have to do? So the first is, like already I said, it is very common at night. So what we have to do? When the mother is sleeping, encourage the mother to lift her foot end, that is like with 2 or 3 pillows she has to support her foot, and then she has to have an inclined posture so that she will be little more comfortable. Okay, so this helps in the decrease of the edema of the mother as well as for the leg cramps. Okay, so you can increase the position of the foot so that it will decrease the leg cramp. And sometimes it is we have seen, like when it is because of the weight bearing, it may be like a spastic type of pain. So you can go in with a massage or otherwise like a local heat application. So already I have said, like whether you can even go in for hot fomentation or otherwise hot water bottle application. So anything you can opt for. So these both are going to have a good effect on the leg cramps. It will decrease. And sometimes you can tell the your neighbors, that is like maybe your who is staying with you, your mother, mother-in-law, your husband, somebody, to massage these areas so that these cramps will be relieved very fast. And then comes the calcium and phosphorus supplements. So in case if there is a electrolyte imbalance, if there is a deficiency of calcium or phosphorus, you have to correct those imbalances. Okay, so that is with your leg cramp. And then coming to backache. So backache, already I said you, so when the mother is not having a correct balanced posture, so if she is using a high heel shoes, if she is not maintaining, if when she is sitting, she is supposed to sit with the spine straight. In case if she is not holding up the posture, when she is walking, she will be automatically, so this is like because of the growing fetus, she will have hyperlordosis. So at that time she must hold the spine posture. Okay, so at that time there will be back pain in case if she is not doing all these things. So what is the management part? So first, avoid excess weight gain. So avoid excess weight gain. Usually you must expect for weight gain during pregnancy, that is around 10 to 12 kgs the woman is going to put on weight. So that is the normal weight of the mother and the baby, that is like the weight of the baby, the placenta fluid, everything together, you term it as like 10 to 12 kgs or 15 kgs, but not more than that. Because of that the mother will have back pain. So when she is having conditions of obesity or hypertensive disorders or diabetes or any conditions which is increasing the weight of the mother, so at that time she may have back pain. And then ask the mother to hold the posture. So she has to hold the posture, that is like spine has to be straight enough so that it doesn't cause any discomfort for the mother. And then provide rest. So whenever she is doing some work, you alternate that area with rest periods. Okay, so in between she has to have a change of the posture, so that is like a lying down posture which is like little more comfortable for the mother, you can opt. And then we have the again the massage and the heat applications, like which is very effective. So any areas of your musculoskeletal systems, you can go in for hot water bottles and hot fomentations. And then exercises, you have to teach mother mild exercises. Okay, so it is for the muscular relaxation, so and to relieve these spasms in the muscular areas. Okay, so usually you can go in for pelvic exercises, which is going to relax the pelvic muscles and it is going to improve the pelvic strength, which is going to help in the labor process. We will have a discussion about the antenatal exercises, that is all your pelvic exercises in detail. Okay, so but now you remember, encourage the mother to do exercises. And then we have fatigue. So this is the final area of the musculoskeletal system. Fatigue is nothing but tiredness. See, already we have discussed the mother is undergoing a lot of physiological changes. So this is going to cause heavy tiredness for the mother. She is like most of the time she is going to sleep, sitting and sleeping, like wherever she is traveling, standing and sleeping, these things will be very common during pregnancy. So again, now also she will be in need of rest. Okay, so provide adequate rest for the mother, and also you have to rule out whether the mother is having some other physiological like other than your physiological change, like whether she is having any pathological conditions of anemia, cardiac diseases, like anything you have to rule out. So in case if she is reporting of severe tiredness and exhaust body condition, all those things, like you have to rule out for the other areas. Okay, so otherwise this fatigue is going to be normal. You can provide the mother with little rest, she will be feeling little more comfortable. Okay, so this is what with the changes of the musculoskeletal system. So we have ligament pain, then we have leg cramps, backaches and fatigues, and we have seen the management part of these areas other than medications, because like usually I don't encourage antenatal mothers to take medicines, because like all your medications, they have side effects. No drug is available without a side effect. Okay, so please try to avoid drugs. So you can do home remedies, definitely that will improve your health conditions. Okay, so with this we are completing this topic. Hope you understood the topic. In case if you have any doubts, go and kindly give your comments in the comment box. Take care, bye.